Meanwhile, the Buckingham Palace says the Duke of Edinburgh yesterday underwent a successful procedure for a pre-existing heart condition at St. Bartholomew's Hospital. His Royal Highness will remain in the hospital for treatment, rest and recuperation for a number of days. Here's Ashley Espiritu of our ABC UK Bureau with that report. Ashley.
Hello, CJ, thank you. Queen Elizabeth II's husband, Prince Philip, was making slight progress after being admitted to hospital more than 2 weeks ago, his daughter-in-law Camilla said on Wednesday. Camilla, Duchess of Cornwall, said the 99-year-old Duke of Edinburgh, who was moved to a specialist unit for heart tests on Monday, was slightly improving. While visiting a vaccination centre in London, she said he hurts at moments, responding to a question from a volunteer there. We keep our fingers crossed, she added, as he recovers. Philip's current stay in hospital is now his longest ever, raising fears for his health because of his advanced age. The prince was first admitted to the private King Edward VII Hospital in central London on February the 16th. Buckingham Palace said initially that he was expected to stay for only a few days after walking in unaided. Later, the palace said that he was being treated for an infection without specifying further. But on Monday, he was taken to the state-run St. Bartholomew's Hospital near St. Paul's Cathedral for testing and observation of a pre-existing heart condition. The hospital, known as Bart's, dates back to the 20th century and has a renowned cardiac unit. Philip had a stent fitted in 2011 after suffering a blocked coronary artery, undergoing treatment at the specialist Royal Papworth Hospital in Cambridge. The palace said Monday that Philip was expected to stay in hospital at least until the end of this week. Philip turns 100 on June the 10th, and his already lengthy stay in hospital has raised concerns because of his age. Camilla's husband, Philip's eldest son and the heir to the throne, Prince Charles, visited him in hospital last month. His youngest son, Prince Edward, and grandson, Prince William, have both commented on his state of health. Edward said his father, a former naval officer, was looking forward to being discharged. William further said that he was in good hands and is being closely monitored. Back to you, CJ.
Well, Ashley, just a quick question. How has the Queen been during this time that her husband is admitted in the hospital?
Well, CJ, Queen Elizabeth II, who is now 94, has herself continued her royal duties despite her husband's illness. Prince Philip is a Greek-born prince who quickly moved up the ranks in the Royal Navy before giving up his career to support his wife when the early death of her father, George VI, in 1952 forced her to take the throne. The couple have been married for more than 73 years, and he has been a constant presence at the side of the monarch, who has referred to him as her strength and stay. He was one of the most active members of the royal family until retiring from the public life in 2017. The couple have been in virtual self-isolation at their Windsor Castle home west of London since the start of the coronavirus pandemic last year because of their age. They have made only brief public appearances and in January were given a first dose of coronavirus vaccine. The palace has continued to inform that the Duke's illness is not COVID-related. So as Prince William had said, as of now, Prince Philip is in good hands and is being closely monitored. Back to you, CJ.
Well, thank you so much, Ashley, for your report. Of course, we're hoping that the prince gets discharged very, very soon. Please take care over there.
Thank you for having me, CJ. I'm Ashley Espiritu, reporting from London, United Kingdom, and we live in interesting times.